Thank you, Mr. Speaker. And as always, it's always a wonderful honour to rise in the House of Commons, speak on behalf of the people of Peterborough Kawartha, but of course, all of the people across Canada who feel they don't have a voice. And this bill we're talking about today, it's a private member's bill put forward by my friend and colleague, I think he's somewhere around here, Cumberland Colchester, who is a doctor himself and has seen the implications across this country of not just a healthcare crisis and access to primary care, but the consequences that have happened as a result of really a downfall of leadership, of inflation, of a cost of living crisis. These things are all connected to our mental health, and so this private member's bill is called Bill C-23, and the summary is that it amends the Excise Tax Act in order to exempt psychotherapy and mental health counseling services from the goods and services tax. So basically it means that right now you have psychotherapists, mental health counselors, they're the only ones who have to charge HST, have to charge tax. And you can imagine for people who don't have coverage, this extra tax that they have to pay out of pocket is a really, really big deal. When we look at people who can't afford housing, who can't afford food, and that's impacting their mental health, and now they can't afford access to mental health and counseling services. And what is great about this bill too is my other colleague from Cariboo, Prince George, who's dedicated a lot of his life's work to mental health. He was key in creating the 988 suicide hotline awareness. So if we could have a round of applause for that, yeah. I think it's a very, very critical piece of legislation that is a very simple to use hotline for suicide hotline awareness. But he amended this bill, and what he amended was to include massage therapy as well. So registered massage therapists are not excluded from this as well. It's kind of interesting, right? Because in Canada today, counseling therapists and psychotherapists are the only regulated mental health service providers that must remit tax on their work. And I want to talk about this a little bit because, so many times you'll hear people say, this is not political, this is not partisan. Mr. Speaker, every single thing in your life is politics. Every single thing. And there's a great saying, if you don't do politics, if you don't want to get involved in politics, politics will do you. And we have seen a massive movement in the last 9 years, quite frankly, where people who have otherwise said, I'm not political, I don't want to do that. Canadians are quite friendly, congenial people, and they don't like confrontation. But when your life becomes miserable and you suffer, you have to stand up, pay attention, and get involved. And that's what we've seen in this country, across this country, because the incidence of mental health in our country has drastically increased. And all you need to do is go outside, walk the streets. Substance abuse disorder is a illness. There's a reason somebody is using drugs or substances to mask their pain, because they can't manage the feelings, emotions, or stress in their life. Did you know the shocking stats in Canada? I want to read some of these for you, but we have 22 people a day who are dying of overdoses. And, this isn't some socioeconomic crisis of people who are, living lower income or these kinds of things. I have people come into my office, moms and dads. These kids came from loving homes. Loving, beautiful homes. Something happened. There was one story of a young boy in my riding who died of an overdose. And his mom came and she sat with me and we talked about him. And she said, things really changed for him when he started to use marijuana as a teenager. And she said, the doctor said it to him so perfectly. She said, when you use marijuana, you don't have the same reaction as someone else, And you're basically allergic to it. Some people can have sugar, some people can't. And that was really profound to me, but the problem is almost 7 million Canadians don't have access to a doctor. They don't have access to somebody who can explain to them what's going on or give it to them in common terms. And you have kids right now who are so lost, and it's a combination of a whole bunch of factors. And you know, when the parents aren't okay, kids aren't okay. And you have parents sitting around the dining room table, they're stressed about trying to pay for housing, they're stressed about trying to afford groceries, they're stressed about every single thing. We have people who are making more than they've ever made in their life, and they are taxed to death. And now we have another tax that's coming in. It's a job-killing tax. It's going to even pull back doctor retention and recruitment in this country even more. In a doctor shortage crisis, you need a doctor to refer you to a specialist. And Canadians don't have access to that. And what does it come down to? It comes down to more tax. So I want to read to you from the Canadian Medical Association. Increasing the capital gains inclusion rate for corporations will create another barrier to retaining and recruiting physicians in a time when our health system and the providers within it are already under constant strain. This not only undermines the well-being of healthcare professionals, it jeopardizes the stability of our struggling healthcare system, the risk of already overstretched physicians, leaving the profession or reducing their hours in response to the heightened taxation is real. Dr. Kathleen Ross of the Canadian Medical Association went on to say, she said incorporated doctors are unlike other businesses as the corporation is primarily used as a vehicle for retirement, savings, or parental and sick leaves. As for the Minister of Finance's comments about provincial governments, she said, we do support remunerating physicians according to their expertise, but also said that pushing the issue onto other governments is not the right approach. Why am I talking about that policy? Because it's all connected. Right now, we have the lowest GDP per capita of any G7 country. That means people have never been poorer. How did that happen? Well, you have wasteful spending, but a big, big piece of it is taxation. And the taxation is used by the government. So you have the Liberal NDP, they have a coalition right now. They spend. They have to make up that money because, again, I'll say it for the 100th time and I'll keep saying it in this House of Commons, the government does not have money, it has your money. It has taxpayers' money. And so if they spend too much of it, they have to make it back in revenue. We saw this, and so this private member's bill is saying enough with the taxation. 46% of Canadians' paychecks are going toward taxes. That's unbelievable. You have to work to June before you actually even start making any money to pay for the tax in this country. It's unbelievable. And so you're taking away the motivation to go to work. Then you have this carbon tax in place. Now, Conservatives have been saying over here for months to axe the tax because we know the carbon tax drives up every single thing in this country. Because when you tax fuel, guess what you need fuel for? Everything. Farmers grow the food, you have to truck the food, you have to get it to the grocery store, the business owner has to rise their prices to cover those increased costs. The Liberals and NDP said, no, the carbon tax is the best thing, it's for the environment, everything's great, we're doing a great job. The Parliamentary Budget Officer writes a report on the economic analysis of the carbon tax, reveals that it's costing $30 billion with a B, dollars more. That's almost $2,000 per Canadian family. They gag. The Environment Minister sends his bureaucrat, his Deputy Minister, to write a letter to the PBO on March 14th, 2024, and says, do not release this report. Do not release it. He gags them. So we put on the pressure, Conservatives put on the pressure. They release the report, and everything we've said is confirmed. You are taxing people into a mental health crisis.
You are.
It is not compassionate, it is not pragmatic, it is evil, is what it is. It's irresponsible. The most compassionate thing a leader can do is make life affordable and give Canadians the autonomy to make decisions for their life, to be able to provide for their family, to want to go to work, to have purpose, to feel proud and confident. This private member's bill is a very simple piece of legislation that removes the tax for psychotherapists and mental health counselors and massage therapists to ensure people can access the resources they need to improve their mental health. We support it, we ask for the support of this House, and we hope it gets passed and Canadians can afford to live and improve their mental health. Thank you, Mr. Speaker.
I thank the member from Peterborough Kawartha. Resuming debate. Reprise du débat.